Colleagues, in the last 2 years, e-cigarette use among young people surged by 135%. And there are now 5.3 million young Americans who use e-cigarettes regularly. It is important to underscore the explosion of flavored nicotine products and the role they play both in this epidemic and in addicting new users. Flavors like bubblegum, lemon drop, and Fruit Loops are widely available and pervasively marketed. 80% of youth, that's 80% of youth that have used tobacco, started with a flavored product. The overwhelming majority of teen smokers and vapors report use of popular fruit, menthol, or mint flavors. Big Tobacco argues flavors like bubblegum cater to adult tastes, but the data shows that flavored tobacco use is substantially higher with youth and young adults. Menthol cigarettes, sweet cigars, candy vapes, and other flavored tobacco products mask the harmless and harshness of tobacco and get users hooked to a dangerous lifelong addiction. While the FDA has established some restrictions on e-cigarettes, the federal policy fails dangerously and falls short and is riddled with loopholes. The federal rules exempt menthol, the original candy flavor, and only restrict flavors in some cartridge-based e-cigarettes. This still leaves e-liquids in every imaginable flavor widely available. The tobacco industry has already introduced the next fad, cheap, disposable e-cigarettes. They are called puff bars. They are remarkably similar to the Juul device and come in flavors like banana ice, grape, and pink lemonade. Puff bars are easy to conceal and widely available because they are exempt from federal e-cigarette restrictions. This is just one of the many kid-friendly products that are exempt. I know we have had to assess and to reassess our priorities in response to the devastating COVID-19 epidemic. Emerging evidence about smoking and COVID-19 suggests that smoking can put people at greater risk. The World Health Organization warns that tobacco use can increase the risk of suffering the most severe symptoms of COVID-19. We know it conclusively that smoking and, in all likelihood, vaping increases risk of respiratory infection, weakens the immune system, and is a major underlying cause of lung disease and heart disease, and diabetes. This pandemic compels us to urge smokers to quit and establish policies that ensure youth never pick up the habit in the first place. SB 793 takes swift action to protect youth and vulnerable populations by prohibiting the retail sale of flavored tobacco products. Adults can still be able to purchase unflavored products at retail or they can purchase any flavored product online. I want to emphasize that. They can still purchase any flavored tobacco product online. While I am disgusted by the youth e-cigarette epidemic, I'm not surprised. It is in line with Big Tobacco's long track record of destroying and devastating our communities. Because of the industry's and tobacco industry's tactics, low-income neighborhoods, people with mental illness, the LGBTQ community, Latinos, and African Americans are disproportionately burdened by tobacco-related morbidity and death. Insidious marketing of menthol cigarettes has exploited African American neighborhoods for decades. 45,000 African Americans die from a smoking-caused illness each year. An estimated 1.6 million African Americans under the age of 18 will become regular smokers, and about 500,000 will die prematurely from a tobacco-related disease. It's a fact. Storefront tobacco advertising is more prominent in communities of color. The tobacco industry has a target audience. Over 90% of smokers start before the age of 18, and the average age of a new smoker is 13. And I've gone back and thought for the last 30 years, and no one has ever told me, I've never encountered anyone that says when they wake up, whether it's at 21 years old, 28, 29, or 30, they wake up in the morning and say, I think I'm going to take up smoking today. It just doesn't happen that way. So enticing flavors, colorful packaging, and names and logos similar to popular types of candy have been used since I was a child to get us hooked. Big Tobacco weaponized decades of treachery to lure a new generation to nicotine addiction. It's time that we break that cycle, colleagues.
Thank you, Senator Hill. Debate or discussion, starting with Senator Durazo, followed by Senator Borges.
Thank you, Madam President. I rise in strong support of this legislation as principal co-author of this measure. The vaping epidemic among our youth is being driven by the widespread use of e-cigarettes and e-liquids used in vape devices, and the statistics depicting this problem are alarming. In the last 2 years alone, e-cigarette use among young people surged by 135%. There are now 5.3 million young Americans who use e-cigarettes regularly. 80% of young people who have ever used tobacco started with a flavored product. It's time for California to take a stand against the widespread advertisement and selling of these products to protect our youth. I ask for your aye vote.
Thank you, Senator Durazo. Senator Borges.
Thank you, Madam President. I want to thank the author and the co-sponsor, Lieutenant Governor, for bringing up this issue. I think what I've seen in my former capacity as an educator, I've seen that there are some less than reputable advertisers in the industry that do find ways to capture an evolving market early on. So I think we do know that youth are vulnerable and marketing does work. And I kind of harken back to the cigarette company that at one point in time during World War II was giving out cigarettes to GIs. It wasn't based on patriotism, it was based on creating a loyalty to the brand and the users. So I know it's there. My question is this sufficiently tailored? So if I can pose a couple of questions to you through the chair, Madam Chair.
Without objection.
So I understand this bill does not cover advertising. It is not tailored to mechanized cigarettes. It includes chewing tobacco, cigars, and what else do we have? I suppose snuff, if people even use snuff anymore. But my question to you is, how was this not, let me rephrase, could you imagine this being more tailored narrowly to go after the most unique and vulnerable segments of the population while still preserving the rights of free choice?
Well, and thank you for the question. I think this is tailored because its goal is to eliminate all flavors. And as I mentioned, 80% of all new young smokers or vapors or whatever product use a flavored tobacco product. So it's the harshness of the tobacco and the taste that when I took my first hit of a cigarette, I think I was 13 at the time, that was the last one because it tasted like crap, frankly, and I wasn't interested in anything beyond that. Now, when you look at other products like a cigar, we find that an interesting, which I think is an interesting number, that youth, the second highest youth of a number of smokers, in fact, I had the number here, is cigar smoking by youth is the second highest. I mean, that is their second fallback, is smoking flavored tobacco cigars of some kind. So the idea is the flavor, not the device, that is attracting the young people to the nicotine. And then once they get addicted to that nicotine, they still want and crave the flavor, but then they will default to whatever provides that nicotine fix in the future.
All right, I won't belabor this much further. This is a financial
Is this a question or on your own
issue.
time, Senator?
This will be my second and my last question.
Will you accept the second question, Senator Hill?
Yes, thank you.
Very
Is
good.
that
Thank you, Senator.
certain funding sources that make their way, whether it be to roads or other services that we have at the county level, maybe through the state, have have we devised a way to backfill the dollars that will likely be lost based on the reduced revenue brought about by this piece of legislation? Because we expect tobacco use will probably decrease some because of it. And I know for example, Fresno County had a measure, I think it was a Measure C back in the day, which went to highway widening and stuff like that based on tobacco usage, if I remember correctly. Do we have a backfill of the projected loss financially?
There are two paths to that, and thank you for the question. There are two paths there. One is, frankly, as I look at it, there is no price that we should be paying, nor a price that we should say that we have to backfill or provide. If this is money that is not spent, there are lives saved, and that the estimate right now from some very valid sources that they would save at least 17,000 lives and $800 million in health care costs, because those people who will be suffering will not have it. But to me, it's dollars. Just as we dealt with COVID-19 and the problems there, we were willing to save lives, to give up a large portion of the economy of the state of California. That was the price we paid in order to save lives. And I think there's no price that we should pay in order here or assume that we will lose to save the lives of the next generation and that next generation, because it will continue after that. So that would be my answer to that question, is that there's no dollar amount, and secondly, that the healthcare cost savings will equal that amount at least. So thank you.
Thank you. Senator Glazer.
Thank you, Madam President and members. I want to rise to commend the author of the bill, the senator from the Peninsula, for his courage and persistence in this matter. This is the second year that you have led us together to move this bill forward. And it's a great bill, and I'm pleased to be one of your joint authors. If you talk to your children, your friends' children, your nieces and nephews, it'll be very clear to you that this is an epidemic of our young people today. It's come almost, it seems like out of nowhere. But it is now the entry-level drug for our youth, this nicotine addiction. It's insidious, it's incredibly dangerous and addictive, and this legislation is long overdue. Thank you, Senator, and I urge an aye vote.
Thank you, Senator Glazer. Senator Rubio.
I rise proudly in support of this measure. I thank our colleague from San Mateo for bringing this forward. I know this is something that we've had discussions on, and I personally been working on it and been very vocal on this. I am alarmed every time I speak to some of my fellow teachers at the creative new ways that manufacturers manage to get vaping devices into the hands of our children. The creativity in terms of producing school supplies that look like school supplies, but they're actually vaping devices, is astonishing to me, from staplers to pencils to even shirts. And so I think even though this doesn't tackle the manufacturing of the devices, just eliminating the vaping flavors alone, I feel is really important to stopping this epidemic, as our colleague just mentioned. In the last 2 years, 3 million more of our youth are vaping. This is something that we need to tackle now and not wait till later. So with that, I ask for your aye vote. Thank you.
Thank you, Senator Rubio. Senator Pan.
Thank you, Madam President. I too want to thank my good friend from San Mateo for leading on this bill, and proud to also be a joint author on this bill. As my good friend from Miranda said, that this is really about trying to protect our youth from being addicted to nicotine as a gateway drug. We know that people who start vaping are more likely to actually use combustible cigarettes. And while some of the opponents may say that vaping is, quote, safer than cigarettes, it still doesn't make it safe. It's dangerous. And we don't want our youth hooked to nicotine. And we have tremendous evidence to show that that is what's happening right now. And they're being attracted because of the flavors. That's what the research shows. So this bill is a narrowly targeted bill toward that very point, that we do not want our youth to start using a device that will get them hooked on nicotine, probably for decades, because it's very hard to stop. In fact, actually, physicians are struggling with how to wean youth off these devices because oftentimes the nicotine doses in these devices are much higher than they could even get in a combustible cigarette. The other thing I do want to also touch on is there was a question that was asked about backfilling costs. I will point out that the cost of the healthcare related to people who start vaping and then perhaps move on to combustible cigarettes is certainly a much greater burden on our state. We have a Medi-Cal program that pays for a third of all Californians. We also have workers who we cover. Also, localities have that as well. It's certainly much greater than what we would collect in taxes. In fact, this was an argument used against Prop 56. Well, it was not focused just on vaping or on general. Someone said, well, what happens if everyone stops smoking? And I said, you know what? We would save a lot more money than any money we would gather from this tobacco tax, and that would be exactly what we want to have happen. And so I would argue that even from a strictly financial standpoint, this bill makes a lot of sense. But I certainly hope we will vote for this bill, not just because of the financial benefits, but because of the public health benefits and certainly the moral benefits. We do not want to see our youth addicted to nicotine. I urge an aye vote. Thank you.
Thank you, Senator Pan. Senator Mitchell, followed by Senator Bradford.
Thank you very much, Madam President. I stand in strong support of Senator Hill, supported it in committee. I've talked often about lung cancer, taking both my father and brother who were exposed to smoking in the military. And so, this is another example for me of an industry that preys on underrepresented communities. According to a national study, 7 out of 10 black youth smokers, are smoking the menthol flavor. And nationwide, census tracts with a greater proportion of black residents have higher tobacco retailer density. And so this is yet another example. The next iteration for this industry are these new products and tools, and they continue to once again prey on underrepresented communities. When I look at the Advancement Project's work in terms of mapping the spread of COVID in LA County, and when you go from west to east and north to south, and seeing how the disproportionate number of African Americans who've been impacted by that virus that attacks the lungs to have pre-existing lung vulnerability as a result of long-term smoking only exacerbates that. And so it's an industry that's preyed on my community, and I will continue to work to elevate that and do all I can to stop it. So I'm proud to stand in support of SB 793.
Thank you, Senator Mitchell. Senator Bradford, followed by Senator Morlock.
Thank you, Madam President. And I, too, want to commend the author for his hard work on this issue. I want to be very clear, by no means do I support marketing to kids, and I think the flavored tobacco industry, that is clearly where they have targeted for the last 10 years. One of my first bills when I got to the legislature 11 years ago was the banning of flavored blunt wraps. And I wasn't able to get that out of Appropriations Committee. I argued strongly that this was targeting our youth, and in 11 years, we've clearly seen the expansion of that marketing to our youth. I stand here as an individual who lost their father to lung cancer. Despite stopped smoking 14 years before his death, he still smoked for over 20 plus years and succumbed to lung cancer, and it'll be 25 years this November. But I do have a concern as it relates to menthol, because we saw what happened to Eric Gardner in New York. He was killed by police simply by selling single loosies, as they say, menthol cigarettes. And it is no doubt that African Americans and Latinos, as well as the poor, that is the instrument or cigarette of choice for them. I don't see many youth or many adults smoking a cigarette product anymore. Most of them are having some type of vaping device that clearly lets out a plume of smoke that just blows me away, that anybody would want to fill their lungs with so much foreign matter like that. And I've sat on panels with law enforcement from all across the country, especially NOBLE, National Organization of Black Law Enforcement, and they're very concerned with the banning of menthol because they believe it's going to give law enforcement an extra tool to stop, harass, and incarcerate people of color or poor. So that's my hesitation, and I would ask that everything in this bill I support, and if we could consider menthol at the same level that you considered hookah and gave them an exemption to this bill, I think it would ease the fears and concerns of many folks, again, mostly adults. And like I say, I'm not advocating smoking, but I'm surely not wanting to give law enforcement, and it says a ban, but the author states that you can still buy something, so either it's banned in California or it's not, because if it's banned and someone has it, will they be arrested for having menthol cigarettes on their person? So, and I'm confused at the fact that they say you can still buy it online. So are you removing it just from retail sales in stores, but you can still buy it online? Again, what prevents a youth then from acquiring this online? So I just have those concerns, and I would just wish that menthol would be given the same consideration that hookah has been given in this measure.
Thank you, Senator Bradford. Senator Morlock.
Thank you, Madam President. I appreciate the concerns about lung disease, and I appreciate the author having a passion in this space. Just find it ironic, however, that while we're working to empower marijuana retailers, this bill interferes in the marketplace. So my libertarian streak is a little concerned because I sort of have a policy that we should allow individuals to do what is legally allowable to do as long as they're not harming others. So I'm concerned about this approach, maybe nanny state if we wanted to throw that old jargon in, but approach to dealing with a legitimate problem. So in looking at this and being concerned about the youth, I'm wondering if it would be addressed better if we took a different approach through a steeper penalty. We're trying to not get flavored products into the hands of minors, and it is illegal for stores to sell to minors, but maybe the penalty should be double or triple or whatever if you are a retailer and you have sold to a minor, or if you purchased it and then resold it as a private individual to a minor or gifted it to a minor. There should be some steep penalties, but I'm trying to figure out why retailers should be impacted, and this bill would allow adults to purchase flavored products online, so someone's going to get a profit, but it won't be the local retailer. So we can't even, I don't know how we regulate online transactions. How would you know that it wasn't a minor? And why should California retailers be excluded from selling these products at a profit? So I'm hoping the author can help me with that, because I appreciate where he is and what he's trying to address, but I'm hoping he could help me in his closing remarks. Thank you, Madam President.
Thank you. Senator Dowling.
Thank you, Madam Chair. I stand in support of this piece of legislation. I didn't get an opportunity to see it in any committee, but I read the bill, and I'm a parent of 3 children. To my knowledge, they are not using any of these products, but I will share with you that I, at a young age, used tobacco, and it's very addicting. It's one of the hardest addictions to stop. It was very difficult for me to overcome that, and I do not want my children to ever even experience it. And I've shared with them, obviously, the downfalls of that. But I want to just say, I know the authors worked really hard on this bill, but I want to add something that I think we're really missing in this legislature, and my colleague from Orange County touched on it a little bit, is the marketing of edibles and the other kinds of cannabis. It is rampant. I fear that actually more than I fear the tobacco for my children, and it's something that I would be happy to work with whoever. I worked on it in the Assembly for years, trying to come up with some ways to stop the marketing of edibles to our youth, because I believe that it is going to be the next thing, as we have seen with these vaping products. So I will stand with you on this bill. I appreciate you bringing it forward. I hope that our youth that never experiences it, but I know it is being targeted towards youth, and I also know that cannabis is widely being targeted to youth as well, and we need to address that. And I know it's difficult, but I would love to be involved in those conversations for the future. So I urge an aye vote on this bill.
Thank you, Senator Dolly. Any further debate or discussion? Seeing and hearing none. Senator Hill, you may close.
Thank you, Madam President. Let me respond to a couple of the comments that were made. This is a retail sales ban on flavored tobacco products only. It is not a increased penalty or fine or arrest opportunity for law enforcement of a minor. They today are not supposed to smoke if they're under 21. I don't think that's enforced anywhere. If they have that, no one's looking for cigarettes on them. This will change not in no way the law and that relationship related to that. But getting to the point of why it's important to go after, deal with, and apply this to retail sales. 74% of the products, the flavored tobacco products that youth get today, they are getting from retail establishments, 74%. Now, historically, before, they were purchasing this online, and they could do that. But you supported and voted for a bill I had last year that the governor signed that took effect in January, and that is the retail, the treatment of tobacco products now that are sent through the post or in any form, purchased online. It applies the same way that it applies to alcohol sales. We don't have an overabundance or problem with alcohol sales today going to minors through the internet or by purchasing. So if you purchase an online tobacco product, flavored tobacco product, which you could do when it's delivered, it will be clearly marked. This is a tobacco product. This package requires an adult, 21 years or older, to sign for it. And before it's delivered, someone 21 years or older has to accept it and sign for it, just as you do today with alcohol deliveries and online purchases. So that's how we keep them from purchasing it online. And the restrictions now apply and have worked, because before this, that's where they were getting it, online. Now they're getting it, continuing to get it at retail establishments. So we've seen an increase there, and I believe we've solved the online sale of that. That's because this is where the problem is. They are purchasing these online. Now, my good friend from Los Angeles raised the hookah issue. The issue with hookah exemption in this legislation is based on the fact that when you look at a hookah, and I learned a lot in this. I was not familiar with how that applied, but all hookah tobacco, shisha, is flavored. It is historically, that is how it is. It is a flavored tobacco product. And as you know, it is consumed through a pipe that's not concealable. It's not something you can walk down the street with. It's not something you can plug into the USB drive on your computer. It is a very large device. And it is also, the use of a hookah is used for celebratory events on special occasions. It's not a daily used product. And that's why it's different than an e-cigarette. It's different than a tobacco cigarette. And it's different than a vaping device. And that's why we felt that it would be appropriate to exclude them, because it's not the same problem as we find today. So if I could continue, Madam President, you know, big tobacco has put a price on our kids' lives, but I refuse to do so. SB 793 will be a public health victory in California. We will protect against another generation getting addicted to these deadly products, and that, to me, is priceless. Colleagues, it's time that we stand up for our youth. If you do not believe me about the tobacco industry's intentions for our youth, then take their words and actions into considerations. In 1975, a Philip Morris executive said, and I quote, "It is important to know as much as possible about teenage smoking patterns and attitudes. Today's teenager is tomorrow's potential customer." And then in 1992, an R.J. Reynolds executive said, quote, "We don't smoke that expletive, we just sell it. We reserve the right to smoke for the young, the poor, the black, and the stupid. In 1994, a manufacturer of fruity snuff said, "Cherry Skoal is for somebody who likes the taste of candy," if you know what I'm saying. Juul purchased ad space on Nickelodeon, Cartoon Network, 17 magazine, and even educational sites for middle and high school students. I implore you to recognize this pattern of abuse and recklessness. Millions of kids are now addicted to nicotine, and the youth vaping epidemic will have unknown and detrimental impacts on public health. With tobacco use being the leading cause of preventable death and disease, we need to be cognizant of the long-term consequences of a new generation hooked to nicotine. 1,300 people die every day due to tobacco-related illnesses. To me, the question is not if we should prohibit the sale of flavored tobacco. Rather, I ask why we ever allowed the most deadly substance on earth to have a candy flavor in the first place. I respectfully ask for your aye vote, colleagues.
All debate having ceased, Madam Secretary, please call the roll.
Allen. Aye. Archuleta. Aye. Atkins. Aye. Bates. Bell. Aye. Borges. Bradford. Caballero. Aye. Chang. Daly. Aye. Dodd. Aye. Durazo. Aye. Galgiani. Aye. Glazer. Aye. Gonzalez. Aye. Grove. No. Hertzberg. Aye. Hill. Aye. Hueso. Aye. Hurtado. Jackson. Aye. Jones. No. Leyva. Aye. McGuire. Aye. Melendez. No. Mitchell. Aye. Monning. Aye. Morlock. Morell. Nielsen. Aye. Pan. Aye. Portantino. Aye. Roth. Aye. Rubio. Aye. Skinner. Aye. Stern. Aye. Umberg. Aye. Wykowski. Aye. Wiener. Aye. Wilk.
Please call the absent members one more time.
Bates. Borges. Bradford. Aye. Chang. Aye. Hurtado. Morlock. Morell.
We'll have to move the call, Madam President.
No. Wilk.
Senator Hill moves a call. Colleagues, we are going to lift the call on file item 38, SB 793 by Senator Hill. Please call the absent members.
Bates. Borges. Hurtado. Aye. Morlock. Wilk. Aye.
Ayes 33, noes 4. The measure passes.